Hello, I'm Michelle Robinson, Vice President and CCO of Stolz and Associates. And with me today is Laci Moyer, Vice President of Pilkey, Hopping, and Ekberg. Laci knows everything there's to know about Medicare. So I asked her here today to kind of go over some basic information, but with a little bit of a twist. We're going to do true or false with Medicare. True or false? You must be age 65 in order to file for Medicare.
Ultimately, that is false. Most people are going to fall into the age 65 and over category. However, if you do have a disability, you can potentially secure Medicare coverage prior to age 65. So that typically falls into people that have Social Security disability income.
Okay.
You've been receiving that for at least 24 months. You could be eligible for Medicare before age 65.
Okay. And then if you are eligible, whether it's through disability or turning 65, there's always this term, the 7-month window or the 7 window, or whatever. You want to explain that a little bit?
Yeah, so when you turn 65, you have a 7-month window, 3 months prior to your birth month, the month of your birth month, and then 3 months after your birth month to enroll. So disability, it would be the same way. So if you're eligible because of a disability, you have the same window, the 3 months prior to your eligibility date, the month of, and then 3 months after that.
Great. All right.
Yeah.
It would be like Carson, did he throw the cards? Okay, sorry. Number 2, true or false? If you are still working at 65, you can defer filing for Medicare.
That is true.
Yes.
You can defer after if you are still working.
Okay.
The main thing to know on that is that you need to be on a creditable employer plan. So every October, your employer sends out a notification. So it's called a Medicare Creditable Coverage Notice, and they are required to send it out by October 15th. So you might get it in August or September, a little bit early, but you want to hang on to that notice because that tells you if your plan is creditable.
And that's the key word right there. You have to make sure it's creditable as opposed to just having any kind of coverage. Right?
Yeah, so you can defer it at that point and just, continue on your employer plan until you until you retire from that plan, and then you have a special enrollment period to be able to go on to Medicare when you come off of your employer plan. But there are some significant penalties if you don't have that creditable coverage notice. So we always say make sure you have that notice, or you talk to a broker like me so that we can help confirm whether you can defer, because otherwise those penalties can add up if it's multiple years after 65.
Nobody wants penalties.
No.
Okay. Number 3, there are 4 major sections of Medicare: A, B, and C. True or false?
That is true.
Aha.
There are.
All right.
We call it the alphabet soup.
All right, well, we're going to get into the alphabet soup here. So let's talk a little bit about each section. So A, I know A is the hospital coverage and also skilled nursing facilities. Is that correct?
Yes. Okay. So Part A, we refer to it as hospital. It's going to cover basically a hospital insurance. So if you end up in the hospital, it's going to cover the majority of the components of the hospital. It can cover skilled nursing. However, it's really important to know that Medicare does not cover long-term care.
This is true. It's a good distinction. You have to make sure,
So if you fall and you break your hip and you end up in a skilled nursing facility and you're improving, it will cover that.
Okay.
However, if you have dementia or some other degenerative disease, then Medicare is not going to cover your long-term care needs.
Okay. That leads us to B. So B is for other medical, so your doctor's visits, ambulance fees, and even some medical equipment. Is that right?
Yes. So pretty much everything else falls into Medicare Part B. So it's all the other components of Medicare that you would need, just like the things that you mentioned: lab work, doctor's visits. Pretty much everything else we just say falls into B outside of being in a hospital, essentially.
Great. And A and B is considered original Medicare, right?
Yes, so we consider those original Medicare. You have to obtain those from the federal government via Social Security. So you go to the Social Security office in order to get that coverage. And they basically cover everything. Part B does have a cost associated with it,
Okay.
whereas Part A, most people have received Part A for no cost because they've been paying into it during their working years.
Right.
So you need to work at least 40 quarters, or that's the equivalent of about 10 years.
Okay.
So you work 40 quarters, and then you're eligible for it when you turn 65.
Great.
Part B does have a cost associated with it, and it is income-based. It's actually based on income from your tax return from 2 years prior.
Yes.
So that's really key if you're getting ready to retire. You want to be planning for that. But basically, it has a cost. It's around $200 for the average person, but as your income goes up, then the cost of Part B goes up from there.
Okay, and it can go down. So the thing to remember that it is based on your tax return. It's also reviewed. So if 1 year you have, for some reason, you have big income, like a huge capital gain or something that's going to affect you, eventually it will go down because maybe next year you won't. So when you see those premiums go up, don't freak out. It can cycle down.
You're pretty knowledgeable about Medicare too.
So C, this is the tricky one. So
Yeah.
C is Advantage, right? And
Yes.
so that is a combination of A and B, but it's through a managed care plan. Is that right?
That's correct.
Okay.
So it's a supplement to A and B,
Okay.
but the insurance company is managing it on behalf of the government. So
Okay.
you still have to go enroll in A and B in order to get C, alphabet soup, right? But it then takes care of everything for you.
Okay.
We really like those plans because they have a lot of added benefits like dental, vision. They typically include prescription, which we're going to talk about in a second.
Jumping ahead. No.
But they have a lot of added advantages to
Okay.
them. Hence
And
word
so
advantage.
There we go. Jinx. Okay.
The biggest disadvantage is that you have to stick within a network of doctors. You
Okay.
also, if you're traveling, if you're a snowbird and you're going to spend 6 months in Arizona or another warmer location, then it doesn't typically work great for people that are going to do that. So there's some pros and cons to it overall, but cost ranges, we've seen anywhere from $0 because the federal government subsidizes the plan all the way up to $200. So
Okay.
which plan works for you just depends on what your needs are.
So if you don't, so you said it was optional. So if you don't sign up for it right away, is there like a year later, you're like, oh, hey, I really, I saw all those commercials on October 15th. I really want to switch my plan. Is that something you can do?
Yes.
Okay.
True.
Right. Okay.
Yeah.
True. Hey, I got it true.
Yeah, you can switch. You can come on to it later, but there are certain time periods of the year that you can enroll on it. So if you choose not to go with it now, and then you have a health event, you end up in the hospital,
Right.
that could be a disadvantage to you.
Sure. Okay. So we're down to D. So D is for drugs.
Yeah. That's what makes it easy.
Yeah,
That's how
it's the
you
easy
always
one, yeah,
remember
yeah.
D is with drugs. So prescription drugs, this you have to get through private insurance. So you have to come to someone like me or go directly to an insurance company or call the ads on the TV in order to get the prescription coverage. There's a number of components to the prescription. So first of all, you typically they have a deductible.
Okay.
They have a copay once you've met the deductible. And then there's a whole other minimal or, a whole bunch of other components to it that you want to be aware of if you have high drug cost.
Okay.
The biggest thing I tell people when searching for prescriptions is to look at the formulary. The formulary is a list of prescriptions,
Okay.
and every insurance company is different in what they cover. So one person might have a list of drugs that gets covered by one company, and another person might have a list that doesn't get covered by that company. They need to go elsewhere.
Okay, so you really want to take a look at that
Yeah.
and make sure whatever you're on or could potentially be on will be covered by the plan that you choose.
Yep. And the cost on these plans we see range from about $5 to $100 per month.
Okay.
And on average, we see most clients in about the $30 range.
Okay.
So it's fairly reasonable. The key is you just have to get it from the insurance company. And there is an income component to this as well.
Okay.
So it's not as much as the Part B.
Yeah.
So most people don't think about it, but just be aware you might see a little bit of an add-on to that cost if you're in one of those higher income brackets.
And is there a penalty associated if you don't get D?
Yes.
Okay.
So this is really important. A lot of people might go into Medicare and not be on any prescriptions. So they may say, I don't need to enroll in this.
Right.
However, if you defer it and you don't enroll until you need it, it's 1% per month forever.
Oh.
So 2 years, you're looking at 24%. And it's of the national average, which is around $35.
Okay.
So that can really add up if 5 years later is the first time you need prescriptions.
Right.
You could be paying a lot more for that. At that
Forever
point.
is a long time.
And forever.
Okay. All right. Ooh, one card left. All right. Number 4. Medicare supplement coverage is mandatory.
That is false.
Ding, ding, ding. Okay.
It's not, just like we were talking about. People can choose just to go with A and B.
Okay.
You don't have to buy a supplement, is
Okay.
what we call it. So,
Okay.
why do people want to buy a supplement?
Why would you?
Yeah. So if you only get A and B, there's a lot of holes in that, is what we tell people.
Yeah.
So the federal government is going to cover a portion of what you need, but there's some things they're not going to cover.
Okay.
So we suggest purchasing a supplement.
Okay.
In this case, the medical supplement is federally regulated. So all the plans across every insurance company are going to be the same.
Oh.
The difference is the cost and some of the value-added benefits that they might add. But all the plans are the same, so they're very easy to compare.
Okay, good. So you'll just, again, want to take a look at what fits your situation and what's best for you.
Yeah, the most popular plan that we see is Plan G, and that has a cost about $200, $250, give or take, and it covers everything except for the Part B deductible, which is right around $200. So I had someone that had a stroke. They were in the hospital, and it covered everything except for $200. So that's why it's so popular.
That's really good.
The other reason it's popular is because you can see any doctor that takes Medicare.
So you're not stuck with that network.
Right.
Okay.
So when we talked about the snowbirds, right? If you're traveling a lot, you can take this anywhere with you in the United States. Even if you move, if you decide to permanently move to a new location, you can take this with you and you don't have to worry about changing plans again.
There we go. Yeah. Well, that was my last card. So thank you so much for all of this information. We hit on a lot of things, but a lot of things we didn't. So a good resource is medicare.gov. That's the official website. Again, you can always reach out to an independent insurance broker, someone like Laci, or check with your financial advisor, someone like me. So thanks for watching. We hope you have a great day. Okay, so I had this other idea, like, okay, check this out. What about Truth or Dare with Medicare? Or, or Medigap Dunk Tank.
Oh, that probably wouldn't be as bad as you think because it's so complicated. I take my chances on it.
All right, well, I'll work on that.